Today we are talking about mental health resiliency and using coping skills to stay in the game of life. My name is Carrie Fear and I am a clinical therapist at Viridian Behavioral Health.
Well, Carrie, thank you so much for joining me today. When we talked about topics and you mentioned mental health resilience, and I thought, what is that? Oh, that's a good topic. So first of all, tell us, what is mental health resilience?
Mental health resilience is something that we utilize in order to keep ourselves in the game of life. So historically, in the last few years, we've seen a lot of videos normalizing a lot of mental health problems that people have, and that was wonderful. In fact, we call that normalization. And quite honestly, it probably saved a lot of people's lives. People felt like they were going crazy, and they went on things like TikTok, and they saw that, wait a minute, maybe I'm not crazy, maybe I'm struggling like other people are, and that was great. But as with most things, the pendulum has swung a little far, and people have started to take that on as an identity. And so now what we're seeing on social media platforms is people are starting to talk more and more about resiliency, utilizing coping skills to keep themselves back into the game of life.
Well, what are some warning signs that people might be having if they're dealing with something, mental health resiliency? And then also you mentioned coping skills. What are some coping skills they can use?
Okay, so warning signs are anything that kind of takes us out of the game of life. Anything that we find ourselves isolating to the point of unhealthy. Things where we start to get so much in our head that we're unable to get out. We're seeing it impact more than one area of our life. We see it impacting our personal life, our professional life, and then just our overall emotional life. So when we start to see those things happen, then we really need to lean in on our coping skills. And a coping skill is anything that helps you navigate that stressor. So if you've been through a big loss, of course you're going to need to retreat for a while. We all need to lick our wounds. We all need to take some time for ourselves. But when we get to the point of isolation where we're not able to function like we once were, then we need to rely on a coping skill. And a coping skill can be anything from a therapy appointment, it can be anything from a medication, it can even be a television show. Anything that helps you, but it also needs to push you back into the hard things of life.
Okay, and it is important, you mentioned it a little bit there, of seeing a therapist, to know that help is available, right?
Yes, help is always available. It's a phone call away. If you ever need emergent help, there's always the hospital, there's people, those hotlines, 988 is a big one, and also friends and family. Just sometimes we need somebody just to distract us and get us out of our head for a little bit.
Well, Carrie, thank you so much for coming on and for some very great information. And thank you for watching. For more information, you may visit viridianbh.com and like Salina Regional Health Center on Facebook. Follow us on X and Instagram.